Terry Kirkland. He's with our fellows to the north, the Prostate Cancer Canada Network Edmonton group. He's a prostate cancer graduate, recipient of a penile transplant, which he's going to talk about tonight, and share his journey with his dealings with prostate cancer. I put down PPP in social and economic political circles. That might mean public-private partnership. In our group, we talk about it personal penile prosthetics or prosthesis.
Kelly, I want to thank you first and foremost for accepting my invitation to come and address the Calgary group. Appreciate that. I understand you had a great, successful World of Wheels. That's good. And I would also tell you it's quite appropriate that I happened to be here a couple of weeks ago when Dr. Klotz was here. The next meeting in Edmonton, we had two individuals that came back to the meeting, who came to the meeting with a Gleason 6, and they were really confused about what they should do. So our advice, much like you don't give medical advice, we send them to your website and say, have a listen to Dr. Klotz. That'll help you make your decision. And they were most appreciative of it because, in fact, we all struggled as we got onto this particular path in life. And I don't know that anybody in this room that had it figured out from the start. I know I certainly didn't. And I'm amazed, even with the Edmonton group, we get anywhere between 40 and 60 people out. We're nowhere near as well organized as Calgary. I hope that Sue has contacted you about getting a support group going. Good, that's good. And we're just really coming into our own. It's been a slow growth period. We're a little slower in Edmonton than Calgary, it would seem. So yeah, we'll get there, and we're using you as a model. So let me leave that compliment with you, because in fact, I think you've got... Well, now we got a couple of hockey teams that are going to be battling here right away. It's really going to cause tension, I'm sure. Listen, my situation is not really unlike most in this room. We've all been on an interesting path. I'm amazed when I get into the Edmonton group how many people have been on the path and how different the treatments have been. To me, that was a real eye-opener. I've only been with the Edmonton group for about a year. But I think when I was watching the screen here, and I think as I was driving down here, what am I going to call this presentation? It's really taking charge of your health. And I think the other thing that I think is extremely important, and because men are so reluctant to talk about their plumbing and what they can and can't do with it, that in fact, I want to talk openly about it. I think that the more we talk openly, the more we get it out there, the more understanding that people have. To me, I went through the process, and I must tell you, I didn't have a lot of side effects. And I've been through the 3 courses that were offered to me. I probably had prostate cancer a lot longer than I ever thought I did. And I got to give you a little background here. I'm married to a nurse, so I'm disadvantaged when it comes to the knowledgeable discussions about medical things. I don't win many of those discussions. But I'll start the story a little bit by telling you that, in fact, she wasn't that keen on my doctor, my GP guy. And I'll refer to the 4 doctors in my world by first name only. And I have great respect for 3 of the 4. So I'll just leave that with you, and I'll come back to it. But my wife was concerned about my blood pressure and how Dr. Jim was dealing with it. So, of course, I'm not without my skill. I say, well, I'll go see your doctor, Nona, and let's see what she says. So I did. I went to see Dr. Nancy, and Dr. Nancy did the full workup on me. You know, she did the dreaded digital rectal examination. She did my PSA. She did my blood pressure. Didn't say a thing about anything. So I walked away. Well, I've won one. There's the blood pressure discussion set aside because she didn't seem to think it was a problem. So we keep going on, and about, well, I think what really brought it to my attention that something wasn't functioning properly, I was losing my erection during lovemaking. That not always, but once in a while. So I go for a yearly medical with Dr. Jim, and in 11 I went for my yearly medical. Dr. Jim does a digital rectal examination. I'm getting quite used to these things by this particular point. And they're highly overrated. They're not that difficult. They're not that hard to deal with, quite frankly. And he fills out my little paperwork, my requisition of all the blood work that I should have done to complete this yearly medical. I take it home. The nurse looks at it and says, "You don't have a PSA test on there, Terry." I says, "You know, Dr. Jim did a digital. He tells me I've got a nice firm prostate, so I don't need the PSA." She says, "I think you should fill that in." I says, "Nona, this guy is really, really religious, and if I fill in that little box there, I think he's going to feel like I'm cheating on him, and I don't know if I should do that." She says, "Well, do it and deal with the consequences." So I did that, and I went to the lab, of course, to have the blood drawn. And the next day, Dynalab calls me and says, "Terry, you got to come back in for that PSA test because we think there's an error." And I said, "Okay, no big deal. It's a little blood. You go back in." They do it again. It wasn't an error. My PSA at that point was 30. So, of course, I didn't know the medical system could move that fast, but frankly, I got pushed into the urology world rather quickly, and I was fortunate because I got pushed into Dr. Ron's office. And Dr. Ron, I had conducted some business with, and my wife worked with him for 5 years. He's a well-known kidney transplant surgeon across Canada. So I thought that this was a stroke of luck, and I go in to see Dr. Ron, of course, and he does the examination. He does the digital rectal exam again, and when he withdraws, I'm a bit of a defensive guy, and I say, "Dr. Jim tells me I have a nice firm prostate." And he says, "Terry, your prostate is way too firm, way too firm." So then, of course, you know the next step. You get thrown into the biopsy aspect of it. And Ron says, "Well, you should read this book and, you know, get up to speed on prostate cancer and what lies ahead for you." None of the books tell you what lie ahead. They might allude to it in some particular cases, but they really don't tell you what's down the track for you. So at this particular stage, I go for the biopsy. I read Dr. Ron's books, and I come back in. I'm 8 on the Gleason scale. He says, "That's not good." I says, "No, I think the book told me that, but the book also told me that I probably should ask for a second opinion." He says, "Whoa, Terry, stop the train." He says, "If I got to get a second opinion on this read," he says, "I've got to go to Toronto. It's 3 or 4 months down the road." Well, I'm like most of you in this room. Somebody told me I got cancer. I'm saying, get it the hell out of me. It wasn't a pressure tactic, I don't think, that Dr. Ron offered me, but it did cause me to say, well, Jesus, I'm not sure that this is the right approach. You know, the second opinion is in the book you told me to read. He says, "Well, Terry, it's just going to slow it down so much." So I said, "Okay, let's forget it. Let's get on with it." So you're scheduled for your radical prostatectomy at that particular time. And it was an interesting discussion with Ron because I knew him. And he was a bit of a friend. And of course, my wife was sitting with me in the room. And he gives you this very clinical chat about prostate cancer. Very clinical. He's not going to off-step his script by any stretch, even though he knows I'm a pretty casual guy. And he says, "Terry, you have a very aggressive form of prostate cancer. I'm going to treat it aggressively. I had a patient that was 47, and he lived till 53. I didn't say a word. I walked out of the room and I said, "Did you hear what that guy said? He just defined my expiry date, and I don't think he has any ownership in that. I think that's mine." So anyway, we did the aggressive aspect. In December 28th of 2011, I have the radical prostatectomy. And I get discharged to go home on the 30th of December with the new friend hanging around my leg, my bag. I get home to celebrate New Year's Eve with my wife, with my new dancing partner. So, and really, at that particular point, you know, you're just going through it, and there's not much you can do. You're riding with what they say. I thought back of it on the way here. In 2007, when I went to see Dr. Nancy, my PSA was 7, I've come to learn. Never got that phone call. Nobody ever told me. I wasn't paying attention. I didn't take control of my own health. I didn't phone Dr. Nancy and ask what's going on here. Now, she could be faulted. I say I have respect for 3 out of 4. That's not bad. But I would have sooner done this in 2007 where the prostatectomy might not have been quite as radical. So anyway, I go through this process. Before I get out of the hospital, I'm on Eligard. And before the end of September, I've had my radiation treatments. I've really had no side effects. You know, it was only the 3rd year of Eligard that I began to feel a little unusual because I ended up with a sleeping disorder. But that was it. So I thought I was quite fortunate. What did cause me a great deal of angst, and something I never read in any of the books at any given point, was use it or lose it. And as I'm going through this prostate journey, I now have a penis that's shrinking. It's startling how it's disappearing on me. I think I'm going to have to part my pubic hairs to find the little guy if I don't get smart on it right away. So the psychology of it began to work on my brain a little bit. And I thought, well, Jesus, there's got to be something going on here that can help me with this. Certainly, I had the option, of course, of shooting the penis with the trimix, and chose not to do that. Thought that there must be something else out. The research that I started on it was, of course, with the penile transplant, or implant, I should say. And I wasn't aware of this except on the internet. And then I attended a meeting in Edmonton, and Dr. Derek was there. And he had the whole apparatus showing you what was going on. And it looked pretty simple. Couldn't find a doctor in Edmonton on the internet that did this sort of thing. I was looking at the Yankee option of anywhere between $14,000 and $17,000, and then coming home not knowing sure you could get any sort of aftercare. Well, Dr. Derek became my best friend, of course. And at that particular point, I said, I approached his office and put me on the list. And he said, okay, it's fine, got a waiting list. Didn't ask what it's going to cost. Wasn't too concerned about that, quite frankly. And, this is still rolling around in my head. What the hell am I doing here? What the hell really is a penile implant? What's it going to do for me? So he calls me and he says, ready Wednesday? And I thought, holy shit. I really haven't thought about this. I said, yeah, okay, I'm in. Let's do it. So we go through the radical prostatectomy, and this is all because of my vanity, quite frankly. Our whole life is about size. Doesn't matter if it's the biggest truck or the biggest house or the best equipment, but at the end of the day, that's driving my mind. Now, I'm 65 years old. Maybe I should have said the hell with it and just lived a big common life. Unfortunately, it does impact on the relationship. And it might be the mind of a male which is not extensive or large, but if I get touchy-feely, ultimately I expect that somewhere along the line, I'm probably going to make love to this individual or this woman. So I did step back from my wife a bit. I just wasn't quite sure how to deal with that, and there was no read on it that I could really get to handle it. So I go through the operation, which was not, I didn't think it was a big thing. I went into the university hospital again, and they're prepping me for surgery the next day, and the nurse says to me, I don't know where she was, she says, what are you here for? I said, I'm here for a penile implant. She says, what? So I explained what was going on. And she says, oh, this is the first time I've encountered that. I said, well, there's a first time for everything somewhere along the line. So I go through the operation, and this just blew me away. But I'm coming out of the anesthetic, and I wake up. There's Dr. Ron standing at my bedside. And I thought, oh, Jesus, now another doctor I've cheated on here, because I didn't consult him. He didn't make a suggestion. Nowhere along this journey did anybody ever think that this was going to be an option. And I don't know if it's a hidden option or we don't want to talk about this option, but it's just not out there in the mainstream. Alberta Healthcare covered the whole thing. Didn't cost me a thing. The only downside of that particular operation, and it was the same when I had the prostatectomy, you're out of the hospital 3 days, you go home, you're not feeling that bad, but you're not feeling that good. The problem with me in both cases is my testicles just ached and ached and ached. So I looked to the nurse, and she can't help me. She lives with me, but she doesn't know anything about what to do there. So finally I got a little frustrated because this is the second time I've had to endure this, so I call Dr. Derek's nurse, and she says, oh, just prop your testicles up with a towel, Terry, so all the draining doesn't end up in your scrotum, and you'll be fine. What a wonderful little bit of advice. Somebody should have told me that first time around. But I talk about that gap in information because, when the surgeon is done with you, with due respect to Ron, it's kind of the end of the story. Now, he came back into my life shortly thereafter because of a little blip, but that has no bearing on where I'm at here today. So I get out of the operation and I go home. My wife thinks I'm a bit crazy. And it wasn't for my wife I was doing it. It was for me. It was for my little pea brain that I have. And as you know, men have two heads. They don't think well with one. Well, I wasn't thinking that well with this one. But it's been a non-event. It's really been a game changer for me. It has helped my psychology. It has helped my self-esteem. It has helped my relationship with my wife. And it really, to me, has given me a whole new energy. The interesting thing, we all talk about this digital rectal examination, and everybody wants to squirm on that. Picture this, if you think that's bad. After 6 weeks, you know, the guy, Derek sends me home and says, don't play with it. Just go home, leave it alone, don't touch it. So you go back, it's after 6 weeks. So he says, jump up on the table, drop your pants. You think a digital rectal exam is something. He takes me by the testicles and pumps it up. Now, imagine that as a man that doesn't want anybody to talk about their plumbing or parts. And I thought, well, we see it works, but you got to squirm a little bit when you're put in that position. And it might not be for everybody, you guys, but it really is something that has to be on the table when you're going through this journey. If you're a young person that's challenged with prostate cancer at 45, you better have this in your bailiwick. I mean, most prostate cancer is a radical prostatectomy, as I had, and of course I made the plea with Dr. Ron, spare the nerves, he says, not even fooling around with it. He says, first, they're hard to see. Secondly, you can't be assured that I wouldn't leave behind some piece and you're gone. The prostate cancer had migrated beyond my prostate. They took out some lymph nodes, and of the 14 they took out, 3 or 4 showed signs of cancer. So, you know, he made the right call in that particular sense. And it has been really a game changer, and I did it. And even though I've done that, and I'm sure that everybody here that's been afflicted by prostate cancer still has that little cancer worm crawling around in their brain. And you get an ache, you get a pain, you get something going on with you, and of course it's difficult to pull that brain curtains back and say, no, it's just growing old, it's just aging, it's just because I exercise too hard or too fast. So it is, life is grand. You know, 5 years out, I don't have any indication. PSA is non-detectable. I function well as a 69-year-old man. The penile implant, of course, as you know, if you have your prostate removed, you are not going to have any ejaculate when you make love to somebody. You still will have a climax, even though you don't have that ejaculate. And it is, for me, it was a game changer. It was a big game changer for me, and it put me in a whole new perspective as far as prostate cancer. I don't spend a lot of time thinking about it. The worm hasn't got out of my brain by any stretch of the imagination. At 69, I think that I probably got another 12, 13 years, and that would be normal life expectancy for a Canadian male. And it's been grand. So I'll take any questions. You can see I'm fairly open about this whole matter. I would tell you that I didn't end up with the same equipment I started with. I can tell you that because of the atrophy. You know, and my comment to Dr. Derek when he had it standing on end, I said, Jesus, I think I've lost an inch or two here, Dr. Derek. And he said, oh, you don't worry about it. You got lots to do what you have to do with it. So, but it is, and that talking openly about it is one of the things I think that we have to do. There's some people that squirm when I talk openly. There's other people that don't. At the end of the day, got to have a little bit of humor to get through life. And I look at it in that particular aspect. There's a lot of my own family wouldn't know this. You know, I was going to invite my brother and sister here tonight to listen to find out something about their older brother. But we had the discussion in the bar today. So they were both quite shocked and set back. But it just shows to go, what does it really matter at the end of the day? You know, I'm Terry Kirkland, I'll always be Terry Kirkland. And nobody knows what the hell's happening with my plumbing. Nevertheless, I think it's important that the world kind of figure out there's options for you. And it is quite debilitating when you become incapable of having sexual intercourse. We as men aren't very good at being sensitive and making sure that in fact the partnership, I don't care if it's holding hands, gentle little touches, you know, all of that kind of stepped back for me for a little bit after it, because in fact I just wasn't sure how the hell this fit into my life. But I'll open up to questions, and I'd be pleased to answer any questions that anybody might have.
You mentioned, I think, your surgeon, Ron.
Yep.
How many of these treatments would he have done before? I'm just wondering how.
Dr. Run didn't do the implant. Dr. Derek did.
Derek.
Yeah, Dr. Derek, and that's why I felt bad when I woke up. I was shocked. I woke up coming out of the anesthetic, and here's Dr. Ron standing at my bedside. And I thought, oh, Jesus, I've been uncovered. I don't know how many he's done, but when I was doing my research on the implant south of the border, it's always about going to somebody that has a whole bailiwick of them done behind them. And it doesn't matter if it's the radical prostatectomy or just the prostatectomy. Always you want to look for somebody that's pretty skilled at it. No different than hiring a good carpenter or a bad carpenter.
So for Derek, is that his practice?
No, it's part of his practice. There's only 2 in Edmonton I've come to learn that do the penile implants. I don't know if there's anybody in Calgary. I could not find anybody in the internet in this province that was doing it, and I thought that it was ridiculous. It's not a complicated process. It's an overnight go home. Don't play with your toys for a while. It's really that simple. So it's a pump in my testicles, small little pump about that big. And of course I have a reservoir attached to my pubic bone, and it's 2 tubes, and 2 long tubes that they implant into your penis. So when I pump it up, the two channels fill up with fluid, and thereby I have an erection. Now, maybe I'm taking this too far, but the penis head does not swell as it would normally under normal circumstances. But listen, it'll stand all day long if I want it to. It's just, I should have had it when I was a teenager. I'd have been in good shape. Sorry.
Going back to the lymph node dissections.
Yeah.
What's your view as to how important they were relative to the ultimate cancer control that you've achieved?
You know, I'd be guessing a bit on that, but because the cancer was Gleason 8, because I'd obviously had it for a while. You know, when he saw that at 07 I had a PSA of 7, never did anything about it. He wanted to be as aggressive as he could, and he was aggressive. I mean, he radical prostatectomy, Eligard before I got out of the hospital, and my wife, being the nurse, gave me the shot in the belly every 3 months, and radiation just as quickly as I was healed up. So it was.
We don't have many men that at least come through our group that have the extensive lymph node dissections that you've had.
Well, he was nervous about it. And that's why he went that extra mile. And the lymph node's an interesting thing because, in fact, when I talk about that little worm in my head, you know, you take the lymph nodes from the right side. The lymph fluid just drains into the leg. Should not be a problem for anybody. Under normal circumstances, it's not. My right leg is an inch bigger in circumference than the left leg. But about July of that year, well, it was September, just before I started radiation, I got so sick I could not, I could get up and go to the business and come home and lay down, and that was it. It was done. So I got really sick, and I didn't know what the hell it was. And my guy was over in Africa being a missionary and doing medical work over there. So I did a walk-in clinic. Guy took my blood. My blood was out of whack. So he sends me for an ultrasound because of the abdominal area, just to have a look. Sure enough, the ultrasound comes back, unknown mass in the abdomen. So you know what I concluded at that point. Nice try, didn't do it. Get your affairs in order. Interestingly, in my case, the lymph nodes and the fluid, my body created a seal and caught it all. So it became toxic. And that's what was making me so sick. It was a simple operation, you know. Again, they had me in that University of Hospital. I watched them just stab it and drain it and then sterilize it. But it's that worm I talk about, you know. As soon as, in fact, the doctor reads that to me, I thought, oh, for Christ's sakes, I went through all of this for that. But, you know, it was fine, so.
Any other questions?
You gotta have some questions of this phony dick from Edmonton.
What's your wife's point of view?
There's another interesting aspect. She wasn't supportive at all when I started it. And now I have to get a little personal here because my wife and I don't make love anymore simply because she has a vaginal problem that's way too painful. And as a consequence, maybe I went through it for nothing, but I didn't. Because psychologically, if she dies, I still need to go find another woman somewhere along the line. So, it wasn't long-term planning. It was just my vanity that made me do it. That's all it was. And she wasn't that keen on it, frankly. We were having a bit of difficulty at that particular point as far as making love was concerned. So it wasn't, the blue pill does wonders, but it can't make that thing stand when you got no prostate. And shooting the needles. And I did have a friend that was explained to me. And I thought, I think I'll bypass that. In retrospect, Dr. Derek should have insisted that I try the needle. It was taxpayers' dollars, and it's probably a $12,000 or $13,000 bill to Alberta Healthcare to make my little vanity satisfied. So, but it's still good,
Are you on any continuing medication?
No, none. Eligard quit after 3 years. But that's the funny thing about taking one med. It can cause you some difficulties, and I did run into that. I did run into that insomnia, so I was prescribed Zopiclone. Didn't do the research on Zopiclone. 10 months later, I got no feeling in my right hand and my right foot, and I'm saying, okay, what's this all about? So off to the neurologist. Nothing matter with me. Just got a numbness in hand and foot. And if you do the research on Zopiclone, that is a very rare potential side effect. I mean, who knows what the drugs do to us that we take. We take them because we want to live. We take them because, in fact, they make us feel better. That's nothing I can do about that at this particular point. I'm just hoping if there was nerve damage done as a result of it, it'll regrow. I mean, I lost the nerves in the side of my face at one particular point. It took about 4 years for them to come back. So I'm just optimistic. It's not debilitating to me. It's a bit of a problem sleeping because the foot is like it's asleep all the time. But all in all.
Oh, it was a permanent side effect?
Well, as far as I can, it hasn't gone away, and I've been off Zopiclone. I've been off Zopiclone now for, as soon as I ran into this and started doing some research. Dumped Zopiclone. So then insomnia really set in. Was a real problem for me at that particular point. I think I'm a pretty strong guy of mind, and I thought I could just overcome it. It's a bugger. It really is a bugger to get back into a proper sleeping pattern. So now I'm cheating. Now I take marijuana oil or marijuana candy at night. And, I don't have a medical prescription, but you show up in Seashell, BC to see a son and go down to the weed shop and give him my Zopiclone prescription and my driver's license, and I'm on the list. So now I'm a bit of a drug dealer for the prostate cancer group because I'm ordering it and not distributing it. Oh, no. I don't care. It doesn't matter. At 69, they can do what they want. So, and that's helpful. But, that again that's where you've got to take control because, in fact, my resident Calgary brother here was giving me the lowdown on how I had to change that a wee bit because if it's THC or CBD, I've never been a marijuana smoker in my life, and I've never been a smoker in my life, so I didn't want to smoke it. So the oil works well. I take 5 drops under my tongue after dinner, and then 5 drops before I go to bed. It helps. I'm getting up with a little bit of a hangover in the morning sometimes, and I must confess, I have a tendency to overdo it. So one night I took 2 of these candies and went to bed. Holy Jesus, you guys. I rolled out of bed because, in fact, I was having a trip. I rolled out of bed. I'm naked as a jaybird. The guy at the weed shop told me if I overdosed on it, have some peanut butter, that's helpful. So I went to walk to get the peanut butter in the kitchen. Unfortunately, I couldn't walk. So I was crawling, and I got to the front door of the house, had to crawl through the living room. I couldn't move. There I am naked, and I'm thinking, Jesus, this stuff's been contaminated with fentanyl. I'm dying here. I'm dying. Somebody help me. Interesting. I didn't want to call out. I didn't want to get my wife out of bed because she'd have called an ambulance. that had taken me away. I thought, well, that's even worse. So I was on the floor for 2-3 hours before I could muster or crawl back to the bed, and I learned my lesson. They tell you one candy. You know, I'm a sweet tooth, and this stuff is pretty easy eating, so it wasn't as if it was a challenge to get down. You just suck it. You know, there's all sorts of candy forms there.
Going back to Terry.
Yep.
Do you think that things have changed in terms of the information that is being made available to men?
Not in Edmonton.
About the option that you pursued?
I'm probably the messenger right now on that. Because when I did this little presentation to the Edmonton group, there was a look of awe on some faces. Never heard of it. Well, you know, we're all guilty of not taking charge of exactly where we want to be in life. So in fact, my thought of the Prostate Cancer Network here is that the urologists really operate in their own little world. They're not quite as interchanging. We've got them speaking to us on a regular basis now. So, and we're into the Northern Alberta Prostate Cancer Clinic for our presentations. So now we're bumping shoulders with a few of them. My thought really was that if we have enough chat, you got to be careful being blacklisted in any of these treatments. And if you don't want to take the treatment they suggest, sometimes you have to be cautious about that. My hope is through osmosis that the urologists in that clinic will begin to pay attention to what's happening. We have some very frank and open discussions in our meetings, and we've had a couple of them there. They have the look of awe on their face because, in fact, there's a big disconnect. I know, and I'll use his name, Gerald, because he doesn't matter to anybody, but he decided that he didn't want to go through a radical prostatectomy, and he paid $22,000 to go to Toronto, and he had HIFU. He came back, he was happy and good. PSA started to climb, he goes back to his urologist. The urologist looks at him and says, "What are you doing in my office? You were here 2 years ago. Didn't want me then. You're not having me now. See ya." So, you know, that certainly is not professional, but there are those individuals out there. And when you challenge somebody with more knowledge than you have, often they'll take strong exception to that. So I think what we're doing here, and you probably do the same thing whether you know it or not, is you are spreading the word as what's out there. And urologists begin to pay attention to what the hell's happening. Because now when the guy's got the Gleason 6 goes back to see his guy and said, well, geez, I watched Dr. Klotz in Toronto. He says this should be active surveillance. So he's going to learn something. They're not all on top of this at any stretch. You know, it's like the 2 GPs that did my digital rectal exam. They don't have that tactile feel for that prostate. You know, he might do 2 a month, he might do 2 a week, but a urologist's got his finger up somebody's butt every day of the week. And they really do have a much better feel for it. Moore was shocked that Dr. Jim didn't pick it up. And you know, and I went back to Dr. Jim and said, listen, you just about killed me. I cheated on you, but you just about killed me. And so we had a frank discussion about that PSA, and he'd just come from an in-service where the PSA reading was causing way too much angst south of the border, and they were doing way too many operations as a result of a PSA reading. That has changed in the mere 5 years that I've been involved. So I appreciated his frankness on it, and I said, well, you know, I filled the PSA box in on you, and that's why I'm alive today. He said, well, okay, that's fair enough. But I think we always have to have discussion. There's always a concern about offending a professional that you want to continue to see. Now, I still bring Dr. Ron a bottle of scotch every year and say, thank you for extending my scotch drinking years. But, you know, he was at fault in some senses too, but they're all busy, these guys. You know, and if you go see, as I say, if you go see the surgeon, he wants to take it out. So.
Did you notice any change in bladder function?
No, I was really good at recovering my bladder function early. Only did I have the occasional stress incontinence. But I was really good at that, and I worked at that all the time. And there's the other thing, you know, the mighty Kegel muscles. If you've been diagnosed with prostate cancer, you should start that day to prepare your plumbing for the day you lose it. Because in fact, it comes back much quicker and much easier. And I got onto the Kegel muscles. I don't know who told me that. Dr. Ron didn't tell me that. I think that I just got a little nervous about the whole matter. And incontinence is, again, is a debilitating thing in your life. It restricts you from doing some things. You know, you don't want to go out in the public and think that, oh, my pad feels pretty wet. I gotta get out of here, and you begin to wait for that sort of thing. So it's quite debilitating when you incontinence. It doesn't matter how old you are. I was fortunate there, and I got quite good at it, because when it's receiving radiation, they want your bladder full. They want your bladder full, so in fact it moves away from the anus area, and they don't scar the anus. So I was good. I could leave work, drink a gallon of water there. By the time I got there, I was full. So the guy in front of me could no longer hold it. He had to go pee, so he got put to the back of the line. I'm sitting there gritting my teeth, saying, no, you can't go. But I did get on their bed one day, and as I was laying there, and they're gracious as can be, as you know. I says, you know, I got to get off this bed or I'm going to wet it. I says, I'm sorry, but I could go drain parts of my bladder and stop. Not everybody had that ability when they're, so I got preferential treatment there, because I could always get ahead of the guy that was there before me for his appointment. And the guy behind me, it was an interesting little experience, but it does change your outlook on life a bit. And when I talk about that worm, I may not look like I worry about it, but am I out of the woods? I think I am, really. We all got aches and pains. Aging is not for the wimpy, I'm telling you. So you got to expect that nothing's going to work. And the big thing for me is, I mean, I was a skinny guy all my life. I carried about 150 pounds as a full-grown man. Put you on estrogen for 3 years. You know, I was just they used to call me a reservation dog when I played hockey, and it wasn't because of the tenacity, but you know, one of the guys dubbed me that. He says, Jesus, Terry, you're like a reservation dog. I said, what the hell you mean? He says, you're all ribs and cock. I says, wow. Hold on, maybe you're suggesting, this is a great big guy, you know. He's a professional boxer, so he was good to have on your team. But so there's where the vanity comes from. No more questions? Did I bore you enough? Well, thanks very much. It really is talking about it openly. And I think when we can get there, and I'm sure that Kelly knows this and you all know that, when we can sit there and squirm a little bit, but know that in fact there's a positive to come out of that. When we all can talk about our private parts, whether they're functioning or not, I think people have to understand the impact of prostate cancer, and we all seem to kind of push it over the corner, and nobody wants to speak about it. And that's why I become a bit of an advocate for getting the voice out there, and I saw that on the website, and I thought I was a fit. So thanks for your attention.